Let's talk about how attachment and trauma responses intersect. To review, attachment is the way that we emotionally bond with others that starts in childhood. You can be securely attached or insecurely attached, which insecure is broken into 3 categories: anxious, avoidant, and disorganized. Now, within insecure attachment are trauma responses: fight, flight, freeze, or fawn. The reason they're called trauma responses is because they are reactions from a stressful stimulus that serve to protect us instead of connect with others. Before I get into the specifics, this is a general video. If you don't agree with some of it, that's okay. This is just to help you get an idea of how these 2 things intersect with each other. The anxious attachment preserves the relationship at the expense of themselves, so they usually aren't the fighters and they usually don't leave because they also fear abandonment. So their normal stress responses are freezing and fawning. Fawning, which is like people pleasing. So check and check. Now, on the other end of the spectrum is avoidant attachment. They usually preserve their self before others. So their main stress responses are fight and flight. So check and check. When it comes to disorganized attachment, they are the ones that have both anxious and avoidant tendencies. It just changes on the situation or the relationship dynamic. So they can have any or all of the combination of these. Check, 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 check. More examples of these types of trauma responses. Fight is obvious. You're like asserting power and dominance, yelling, calling names, usually verbal assaults. Flight is kind of obvious too, just bouncing. Freeze and fawn are a little more complicated. Freezing is like overthinking. Like when your body is literally frozen, you don't fight, but you don't leave either. You're just kind of stuck. And then fawn, again, the difference between this and like comforting somebody is you do it out of stress and you do it at the detriment and sacrifice of yourself. The goal in understanding all of this and coming to secure attachment: 1, you can identify when the anxiety is happening and also when it's not happening. 2, you can understand the situation that it's happening in and the context of attachment. And 3, sitting with the feeling and learning to tolerate it so that you can come down to a physical calmness and then respond rather than react. Because the way to heal attachment and to kind of respond rather than react, the way to do that is to just slow down and literally come to a calm baseline, let some time pass, and then respond in a way that preserves yourself and the relationship.